Cognitive rehabilitation. It is possible to restore cognitive function. This has been a controversial question for a number of years. There is still limited evidence to make a definitive answer. Placebo-controlled double-blind studies are very difficult, and some would say impossible. In this field, and scientific progress has usually relied on single-case methodology. There is now some evidence that the number of cognitive problems are amenable to a rehabilitation strategy, including attention deficits, unilateral neglect, some deficit in communication, including dyslexia, some aspects of memory dysfunction. In broad terms, functional benefit can derive from a broad cognitive approach that adapts two stages, two strategies. Bypass the problem or find another way to achieve the same goal. Use residual skills more effectively. Finding a way around the problem. A number of strategies can be designed according to the individual problems. People can be provided with assistive equipment, individual with memory problems. For example, can be taught to use external memory aids such as diaries, lists, alarm clocks, timers, and tape recorders. Reminders on mobile phones are also useful. However, these methods are not always successful as people need some residual memory in order to remember what they are being reminded about. There are commercial systems that are radio controlled, and a central switchboard will transmit a message into a small communicator reminding the person what needs doing at that particular moment. Another strategy is to reimagine the immediate environment in order to reduce cognitive input. Sometimes this will involve a rigid organization of daily life so that limited planning and organizational skills are required. A very structured day with diaries and prompts from another party can often assist someone with aspect of the executive syndrome. Organization of physical space such as labeling drawers, doors and kitchen utensils can be helpful. Sometimes simple measures can help such as applying simple clothing with label and velcro fastening for people with dressing apraxia. There are a whole variety of strategies that first need an accurate neuropsychological assessment and then application of a common sense way to get around the problem. Using residual skills more effectively. There are a number of techniques in this area that have mainly been developed in the field of memory. Mnemonic strategies have been used, including imagery, where information is remembered by an association with a particular image. An example is the post mnemonic. In this technique, individuals are taught to preview information, set questions to themselves on the information, read the information over, state the information again, and test the results. It is hoped by this method that the information is more deeply encoded. There are many other techniques that can use acronyms, rhymes, and systematic cueing. There are well-known series, such as the alphabet is scanned through cue and appropriate memory. This and many other techniques are designed to use residual skills more efficiently and now have been shown to produce real functional benefit and lessen disability in many people. In an individual case, a number of different strategies can be used. It is vital that the main carers and family are involved in the regular and routine implementation of an appropriate strategy.